As a surge in COVID cases hits the population, a top epidemiologist says we're flying blind on the true extent of infection because there are huge gaps in our surveillance. There were 9,307 new community cases reported today and sadly another 22 deaths. That takes the total death toll so far to 1,663. But Professor Michael Baker says we actually don't know how many people have COVID because we're not doing regular community sampling, nor are we investigating people's immunity levels like other countries are doing like in the UK. And new figures obtained by Newshub show when our borders first opened, only 1.5% of international arrivals had their positive tests sequenced to monitor what variants were coming into the country. The school holidays are here. Thousands are flying out and thousands are flying in. Coming in too are COVID-infected travellers. But the actual prevalence of infection in New Zealand right now isn't known.
We're basically flying blind in terms of level of infection and level of immunity in New Zealand.
We have the daily case numbers, but Professor Michael Baker says that is not a true reflection of the situation.
We've got big gaps in our surveillance knowledge. We don't know the level of infection in the community. We don't know much about immunity.
And does that disappoint you as an epidemiologist?
Well, I think we should all be disappointed because it means that we can't inform our decisions with essential scientific knowledge.
To get a real understanding of COVID, he says we need regular infection surveys when you test different groups, different regions, even different schools at regular intervals to get more reliable real-time data. He also wants serology or blood testing to detect immunity and better research about compliance with mask use and isolation rules to see how it relates to infection levels.
This is one of the most basic tools is an infection prevalence survey, and we need it now. We really needed it yesterday.
At the moment, the ministry's data relies on people to report positive rats, but many aren't bothering. Baker estimates it's likely we have 50% more daily cases than what ministry figures show. We could be looking at more like 15,000 cases at the moment.
Quite easily, yes.
Another area our surveillance has fallen short is at our borders. When they first opened in late February, the Prime Minister said all positive rats should be followed up by a PCR so they can know what and when new variants are entering the country.
Positive rats must be registered and followed up with a PCR test.
But new figures show that genome sequencing was slow to start. Between late February and late March, 1,166 arrivals tested positive, but only 18, that's just 1.5%, got sequenced. The following month, just over 2,500 tested positive, but only 311, that's 12%, were sequenced.
We didn't have all the data we needed to say what was coming across the border. We didn't have high confidence about, what was arriving at the border at that time.
Since then, it has improved. Between 20 and 40% of those landing who test positive using a rat then get a PCR for sequencing.
It's a pretty good sample. It gives us a good overview of what's arriving. I think we could do a little bit better. I think we could make it easier for people to get that PCR.
Like, for example, being given an at-home PCR kit on arrival at the airport. Alternatively, Leon Grice from Rako Science says it has saliva testing sites already running at the airports.
There's no reason why you couldn't be doing PCR at the airport right now, and that will give you a bigger sample base to find out how many people were positive coming across the border, and also give you the samples to do the genotyping of what variants coming in.
For Leon Grice, Dr Welsh and Dr Baker, our surveillance could be much better because we need to know with accuracy when more dangerous variants are arriving and what's happening with COVID in different communities. That will help lessen the impact of this second wave.